I want to tell you what I've learned from the volume of patients that I've seen in the 8 months that I've been doing it. You have to understand that there's a segment of the population, and I call them doobie ones. The reason that they're doobie ones is that when I ask them if they know what a doobie is, have you ever seen one, smoked one, rolled one, they get wide-eyed and say, well, I've heard of the Doobie Brothers, but short of that, I have no idea what you're talking about. Then you know what I do? I back up even one more. I say, how about a joint? Do you know what that is? Because pretty much anybody that's ever encountered cannabis knows what a joint is. Doobie's kind of a slang phrase. Well, if they say, well, yeah, I got an elbow and a knee, and I've heard of the Joint Chiefs of Staff, that makes the patient what I call a doobie one. You have to understand the doobie ones have been living in a box. Be they 22-year-olds. I had a gal last week, 22-year-old Crohn's disease patient, on Remicade, narcotics, was homeschooled, grew up in a very religious family, had never seen cannabis, known anybody who did cannabis or whatever. At age 22, her parents literally disowned her from coming to see me to wanting to try medical cannabis instead of the other medicines that she was on at age 22. I have 65, 70-year-olds, 80-year-olds that have never used cannabis in their life, that have been Nancy Reagan, just say no. Egg frying in the pan, this is your brain on drugs. A cloud of smoke hanging over Woodstock as their vision of cannabis. So what you have to understand about those doobie one patients, not only have they never done it themselves, but they've never known anybody else who has done it. Now, patients that are doobie twos have done it in the past. They've stopped so they can be 65 and now it's 40 years later. But each and every one of those people in general knows somebody that continued from high school or college days, friend, relative, whatever. So they're aware that there are some people out there that actually use cannabis that are not sitting on the couch watching, 2 episodes of Jerry Springer with a side order of Dr. Phil, Patrick, and eating 2 bags of Doritos every day. So I look at the doobie one patients and say to them, what you have to understand is that there's what we call doobie threes, people that are medicating with cannabis, not necessarily every day, although some do, but people that have used it throughout their lives and have been fine. Raised kids, paid bills, gone to work every day, been very honorable citizens, albeit outside of the law, and nobody wants to do that, but the power of the substance for positivity for them has made them not obey that aspect of the law. But real important, I'll tell you, Patrick, the doobie ones love it when I say to them, listen, everybody, I got 32 years of emergency medicine practice. I'm trained to recognize intoxication. The doobie 3 patient, the current medicator, the current user of cannabis, they could have used it a month ago, a week ago, a day ago, even quite frankly, coming in to see me, or 10 minutes after leaving, and I don't know who they are until I talk to them. So I look at the doobie 1 patient and tell them my job for you is to make you a functional user of cannabis, not high, of course, because those patients are definitely afraid of getting high. They've avoided it their entire life.
At this point.
Of course.
Right.
But when they find out that we can manipulate the CBD and the THC ratio when we start them and then move them up to that nice, comfortable level, it's a very comforting thing.